Hi, my name is Amanda. I'm a cardiac surgery registered nurse here at Beth Israel Deaconess Medical Center. I'm going to be talking to you about danger signs and when to call your doctor. Here is a list of symptoms you should know. Call 911 to be taken to the nearest emergency room for any emergency situation, such as chest pain not related to your incision or angina pain similar to the pain you had prior to your surgery. Extreme shortness of breath or difficulty breathing that does not resolve with rest. Severe bleeding, especially if you are on Coumadin. Fainting, severe lightheadedness, or changes in your mental status. We always encourage you to call your surgeon if you have any questions or concerns. You can call them 24 hours a day, 7 days a week. If any of the following should occur, immediately call 617-632-8383. If your incision is warm, red, or swollen, or if there's any increased pain or tenderness. Any of your incisions have any fluid or drainage coming out. You have a fever of 100.5 or higher. Your weight has gone up greater than 2 pounds in 1 day or 5 pounds in a week. You have severe pain or increased swelling in either leg. You have palpitations. You notice any of the following, especially if you are on Coumadin. A lot of dark, large bruises, black or dark bowel movements, pain, discomfort, or swelling in any area, especially after an injury, severe or unusual headache. If any of your symptoms are severe, please call 911. If you do go to another hospital due to an emergency, if possible, please bring your discharge paperwork with you to share recent medical information with healthcare providers or have them contact your cardiac surgeon directly for information to help in your immediate care.